84% of the women that we surveyed in this research didn't even know there was a connection between menopause and oral health. As our estrogen level drops, so does saliva productivity. That is super important. We start feeling things like dry mouth, that tooth sensitivity or gum sensitivity, which is related to the hormonal changes that we're all going through. What's happening to you as you go through these hormonal changes is any kind of failing. Just embrace it, own it. We all go through it. At the end of the day, you own your own health.
Hey everyone, welcome to another episode of Hello Hot Flash, where we help you control the midlife change. Today I am here with Sarah Chavarria. Sarah is from Delta Dental and she's a lovely woman, you guys. We had a conversation and I'm enjoying it already, so I can't wait to bring you in. Sarah, thank you so much for being a part of the show.
Oh, thank you so much for having me. What a fun name of a show.
I know, I love it. Is that okay for me to say I love the name of my show?
I think it's perfectly fine. Own it.
Good, good. I'm owning it. Thank you once again for being here. Sarah, you're a CEO, and as a CEO, you've chose to elevate the issue of menopause and the impact that it has on our dental health publicly. And I'm so excited about that. What made you decide that menopause and oral health deserved industry level attention?
Well, it started with listening. Look, I was going through my own transition from perimenopause to menopause, and I just did what I think a lot of us do, which is start asking women who kind of were around my age and listening to how they're all of us were really managing our private journey through menopause with very light links to each other, and certainly not talking about it at work, even though we all know it affects how we show up. It affects our mood. It affects, a whole bunch of things because you go through a ton of stuff. And so um, I recognized that I had an opportunity in this role as a leader in an organization to start making it okay to have the conversation about being in menopause and some of the impacts. And then of course we're in the oral health business, and I asked my team one day, hey, what do we know between the link between oral health and menopause? My personal journey, went to my dentist and he said, do you have any health changes? And I said, yeah, I'm in full blown menopause. And he kind of backed up and wrote something super quiet on his notepad. And it made me feel like, wait a minute, like, isn't that a big health change? And it is. And so we spent a little bit of time doing some research so that we could help other women and men who have women in their lives appreciate that there is absolutely a link between oral health and menopause.
Yeah, and that was so surprising to me. Like, as in after perimenopause, probably when I first started this podcast, I'm like, wait, what? Oh, the light bulb starts to go off. So that was really smart of you. And I'm happy that you're in a position where you can bring this to the forefront. I know you guys have done a lot of research on it as well. So what makes this so important is that, again, many women experiencing these changes, they don't immediately connect it to menopause. But Delta Dental's recent report found that more than a third of women over 40 notice changes in their teeth and gums. If someone's listening is experiencing any of this, how is it, or what makes it reasonable to connect this with menopause?
I think just bringing it front of mind and thinking, okay, look, I'm experiencing something different in my mouth. I'm noticing that my teeth or my gums look different. For some of us, I feel this burning sensation. I'm flossing, I'm trying to do a good job, but my gums are bleeding. I've got sensitivity, and just creating awareness to think about those could be related for many of us to the hormonal changes that we're going through as we go through perimenopause and menopause. And so I think for a lot of us who experience something, I don't know about everybody else, but I always worry, oh my gosh, something's terribly wrong. And we wanted to create awareness to kind of pause and think, well, wait a minute. These could be some very normal things that you're going through simply related to the transition to menopause and those hormonal changes that we're having.
Yeah. So if women are noticing these changes, the next logical reason or question often becomes like, why? Why am I seeing these changes? So now I want to get a little bit into the specifics. You talked about maybe the receding gums, bleeding gums. What happens to our mouth during menopause, and what are the most common symptoms that women find?
So, look, as our estrogen level drops, so does saliva productivity. That is super important because with that reduced saliva, now we have the management of the good bacteria and the bad bacteria, right? Kind of reduced. And so we start feeling things like dry mouth. That's a good indication that that saliva production is reducing. And that tooth sensitivity or gum sensitivity. And all those things become really important because now you want to start talking to your dentist about the impacts that could have and make sure that you're going to the dentist so that you prevent, having some kind of periodontal disease. And that becomes an indicator for even other things related to our overall health. And so I think that being on the lookout for some of the simple symptoms like dry mouth, like changes, like tooth sensitivity. It is specifically related to that reduced saliva production, which is related to the hormonal changes that we're all going through.
Mhm. That is so huge. And in their introduction, you guys, if you listen to the introduction, I talk about the impact of that inflammation, like on even on our heart health and our bone health. Like this is a really big deal that I think sometimes we may dismiss and think, oh, just my teeth kind of thing, but it's really important. So as and while these symptoms, again, they may sound small on paper, they often have a bigger impact on a woman's daily life. Is oral health during menopause just about discomfort, or can it affect our confidence, our focus, even the way we function daily?
I mean, think about it. You're in a meeting or you're giving a presentation. I'm here with you, and all of a sudden you have dry mouth and you're unable to get some of the words out, and you're mispronouncing things or whatever. But I mean, like it messes with your confidence. I mean, not just is it's about your health, it's about your confidence, how you feel like you're projecting. It's about nutrition and what you're able to eat and how you're able to chew. And it just I mean, there are so many factors that get impacted when you have oral health changes that you're experiencing. And I think that's really important because we know that 45% of women 40 and older have absolutely shared through the research that we did that oral health changes or experiences are impacting how they show up to work in more ways than we could possibly imagine. But maybe we could because we're women, right? And so we're drinking extra water. I mean, thank goodness that, it's okay to walk around with straws sticking out of big cups because it's made it okay to attend to some of that hydration that we need, which is good for your overall health. But one of the things we share with women is drink a lot of water and, keep that mouth hydrated.
Again, just small things that we wouldn't normally think about. So you're already in this stressful situation. You're having hot flashes, or you're anxious about things, and now your dental health is off. So anything that we can quote unquote fix, I think is super super important. Um,
Yeah.
so I'm going to talk a little bit about what's really missing. So what's surprising is that even though so many women are experiencing these changes, the conversation isn't happening as often as it should. So that's what it got me excited about Delta Dental. I'm like, oh, wait, someone's actually having this conversation. And that raises an important question about the healthcare system itself. So the report that you guys did showed very few women are proactively discussing menopause with their dentist. So is this a patient gap, a provider gap, both? And why has this conversation been missing in healthcare?
It's both. So we learned that, first of all, 84% of the women that we surveyed in this research didn't even know there was a connection between menopause and oral health. So why would you bring it up at the dentist, right? So start there. So that's a little bit of a gap. And then you've got, from our research, more than 75% of dentists are like, hey, I am ready to talk about menopause with my patients, but half of them don't want to bring it up first, right? And so it creates this really interesting gap where what a beautiful place to start that conversation. I mean, you're connecting with a healthcare provider who can really help you appreciate what's going on for you individually and where you're at in your overall health journey and how that oral health is helping to, keeping that healthy kind of points to overall health. So the gap we want to close is we've done a lot of work since our research to put tools in place to bring awareness, people like you inviting us to talk about this so that listeners can say, you know what? I'm going to go to the dentist, and the next time I go, I'm going to talk about some of the things I'm experiencing. So, we've created email templates to send ahead. We've said, talk about the symptom. Like tell your dentist, like, hey, I've got dry mouth and like what's going on there, just to open the window. Because if we can close the gap by just having them have that conversation, we all win
Yeah.
because it's another place where we can have a conversation about our overall health. Look, 29 million Americans don't go to their primary care physician, but they go to their dentist twice. And so those are
I never
two
even thought about it
opportunities,
that way.
right?
Yeah, yeah,
It's
that is
two more
true.
opportunities to connect with someone and say, "Hey, what's going on? Like, what are we seeing? Is this just something I should expect is okay? And then how do I manage it?"
Yeah.
So,
I think that's really, really smart. I never even thought about that. Even as, as a wife who instructs her male sons and her husband, like, have you gone to the doctors? They won't do that, but everyone goes to the dentist twice a year. It's just like something common. And bringing that conversation up for me, it actually saved my tooth. So I had on my Hello Hot Flash hoodie, and plus I know my dentist, so he knows what I do. And so I was having all of this pain, and we started this conversation. I could, in my mind, I could see another dentist may have just extracted the tooth or given me some type of medication, but he actually talked me through it because he understood where I was at. And then we, in turn, were able to save the tooth. I had some, I did some changes around what I ate and so forth. So I wanted to like kind of bring that back to real life, that having those conversations are super important. And I love that you guys have the email templates. I'm sure they're on your website, correct?
yes.
Yeah, yeah, yeah. So I'm going to make sure that we have those links so that people can go back and see that information, because being able to advocate for yourself is really, really important. One
Well, and just, I'm sorry to
no,
jump
no,
in, but,
no.
again, just, thank you to you because even through our research, we learned that women who get this awareness, whether
Yeah,
they participate in our survey or they listen, hear, 70% of them say, you know what, I'm going to go schedule a dental appointment and I'm going to figure out a way to have this conversation. And wow, if that's the return on investment for those of us willing to talk about it, again, what an amazing return.
yeah, yeah. That's so true. So true. I love that. Once we understand the connection between menopause, oral health, the next step is thinking about how care should evolve. And because the way we approach dental care in our 20s, again, isn't necessarily the way that we can approach that now. So, how should dental care evolve in our 40s and 50s? How should it look differently than when we were 20 or 25 years old?
I mean, like, I think that, especially, those of us who, I mean, I'm 55, so, I
Okay.
like to think I'm wiser today than I was in my 20s, but I also think, in where I'm at with healthcare, I like to think about it as holistic, right? I want to know what vitamins should I be taking? How do I protect what I have so that I can stay healthy, be active, and live a long, healthy life. And so, I think it's connecting that oral health to overall health and finding where it fits into that journey. I mean, you just said your dentist really met with you as a person and appreciated your whole health, and thus was able to save a tooth that another dentist might have extracted. And that's a big part of kind of transitioning from going to the dentist for that tactical thing, right? So I'm going for a cleaning, I'm going for a root canal, and really stepping back and having that relationship with your dental office about how that oral health fits into the overall health that you have, right? And a lot of dentists do those questionnaires, and those are really important. I mean, if you're a diabetic patient, if you're a patient going through perimenopause, that health and where you are in your own journey, it evolves over time, and it means that how you sit in the dental chair and what that oral health looks like is unique to you. And isn't that what healthcare is all about? Is really about that personalized experience that you're bringing, your dentist is bringing, your doctor is bringing, and all your wonderful research is bringing,
Yeah.
to, position us for better health.
Yeah, I know. It's like as we get older, it's like it's going back to like when we're an infant, we need a lot more doctors touching us.
Yes. I had a friend actually, he's 70. He
Uh-huh.
said, when you get to my age, your two best friends are your doctor and your dentist." And I was like, "Oh, okay, I better make sure I like continue to cultivate those relationships," which, I'm really lucky. I have a new dentist since 3 years, and you know, just happened to choose a woman.
Right?
And then my doctor and I, we've known each other for 25 years, but it is slowly becoming that, where
Yeah.
it is
Yes.
looking and feeling like a friendship.
It is. When you start knowing their kids' names, you're like, wait a minute.
Exactly.
What is this? I love it. I think again, it's just really important and helpful that we're understanding this issue. But a lot of women listening, they're probably wondering, like, what should I do next? Should I go get the email template? Do I have a conversation with my doctor? What does that look like? So, what specific phrases or questions should women use at their next dental visit?
I think the first thing I'll say is I appreciate that not everybody's ready to kind of walk in and declare kind of where they are in their health.
Yeah.
And I think starting with being comfortable walking in and saying something like, hey, could the symptoms that I'm experiencing and name those, right? I'm feeling like I have more dry mouth, or I'm noticing some changes in my gums, asking the dentist or the dental hygienist, could those be related to where I am in life, right? I feel like, I'm 48 or I'm 52 or where some women go through menopause at 37, right? So, this is kind of where I'm at. Could those symptoms be related to my perimenopause, my menopause, or can we talk specifically about how the hormonal changes I'm going through might be impacting my oral health? And I think this is really hard for a lot of us, but maybe practice getting comfortable pushing a little bit back if you're not feeling like those things are being addressed. And I know it's hard because you typically have hands and tools and instruments in your mouth, but I think it's okay to pause and say, hey, I'm not sure all my concerns are being addressed. Can we just take a step back and talk about the hormonal changes that I'm going through and what I might expect? And I know that can be hard for some of us, but I think it's really important, just in the spirit of owning your own health and making sure that that connection with a healthcare provider, which is what a dental visit is giving you the information you need to go back and better care for your oral health, and making sure you've got that. And then I would say finally, invite your hygienist, invite your dentist to make contributions to your overall health, and ask them, can we make sure that everything we're doing in my dental visit is playing a part in my overall health, because blah blah blah, right? So having those conversations about drinking water, should you use a water pick or not, what does flossing look like? And for some of us women, going 3 times a year when you're going through hormonal changes. We learned through our survey that dentists and women might be more likely to talk about it if we had a product, right? So we launched a women's product. And a part of that is I go 3 times a year because those hormonal changes, I mean, they can impact you quickly or overnight. And so I want to make sure that I have 3 touch points a year while I go through my beautiful menopause journey so that we're identifying things early because it's really preventative care. So I think if women could get comfortable with some phrases like that, and if you're really uncomfortable, the email template is a way to send it ahead of time. That's also a good practice. But practice makes perfect, and I think most of us will be surprised if you open up the conversation. They're going to be ready and to go there. So
What happens when the doctor isn't ready, or they're like, ah, that has nothing to do with it?
You know, so I had that experience, right? So remember, this kind of all started. So I was 51. My doctor had already told me, Sarah, welcome. You're in full blown menopause. And so I tend to be very direct. And, so I went to visit him and he said, any health changes? And I said, I'm in full blown menopause. He kind of made a secret note and then we just, never talked about it again. And, what that meant for me was really going back and reflecting, what am I going to need from a dentist? And so when I went back to him, I said, I walked in here and shared that I was in menopause, and I went and talked to other people, and there's a connection here. Um, how comfortable how comfortable are you and your team,
Right.
really partnering with me on this? Because I don't know, should I come 3 times, whatever. Anyway, very long story short, I made a dental change
Mm.
and went in search of a dentist that and I had been his patient for over 20 years.
Oh, wow.
um but I recognize that this was not an area that he's in that really small percentage, right?
Yes,
But
yes, yes,
he was close to retiring. He
yeah,
kind of didn't want to go there. And I think that's okay too. I'm raising 3 grown children, and it's like, look, I mean, it's an important relationship. So you have to make sure you have that relatability. So
yeah,
in my case, um, I went and changed dentists. And when I met with the new dentist for the first time, I said, part of why I am looking for a change is because I want to be able to have these conversations. And she said, oh, yeah, I'm in perimenopause. Like, let's go.
isn't that the best
So,
part?
yeah, it just happened to work
You
out. But
connect?
I don't want to make it sound like you have to look for a
No,
female dentist. There
no,
are
no.
plenty of um, dentists overall. Remember, 80%, 75, they're ready. And I have some wonderful dentists on my board and that we interact with. But it's just find somebody who works with you
Yeah.
and be okay making that change.
Yeah, my dentist is a male. I've known him for years and
Yeah.
years. So yeah, there's some good ones out there. But that's what I wanted you to get to, because I believe that that's part of an advocacy role that we don't always take hold of, that we are the consumer. This is our mouth, this is our body, this is our brain, and we have to own the fact that if they don't understand or want to serve us, then perhaps it's an opportunity for us to find someone else who would. So I'm happy you shared that story.
Yeah, I'm happy you put an underline and an exclamation point on that because I think coming back to each of us feeling like at the end of the day, you own your own health
Yeah.
and you're really looking for partners to help get the health outcomes that you want. And being an advocate is so important for yourself. And then what an honor to be invited to be someone else's advocate if that person can't help themselves, right? Be it your child, your parent, or whatever. So, so important to feel empowered to, yourself best.
Yes, yes, that's very true. Don't let anyone else tell you that it's all in your head. It's not.
Yeah.
You're
No.
feeling it. It's there if you're feeling it.
Sometimes it's not in my head. I walk to a cabinet and I think, why am I standing here? What was I
Very
coming?
true. Also part of this wonderful phase in which we
Oh,
are
yes.
in.
Yes.
When we've talked about advocacy, we've talked about the impact of our oral health and how it relates to menopause. For women hearing this conversation and realizing they want more support, I heard you mention that there's a new product in the Delta Dental line of products. So tell us a little bit more about Delta Dental and how women can access your services.
Oh, yeah. Would love to. Um, Look, we started this conversation. I'm 55 now. I was 51 then. So we've been on this
Oh,
incredible
wow.
journey. And, part of bringing the research back into our own organization, we take care of 31 million Americans and many more through our foundation, was how do we change how we think about the products that we put in the market when we have these beautiful insights?
Mhm.
Like, women going through hormonal changes have unique needs, especially as it relates to perimenopause, menopause, but pregnancy is a hormonal change too, right? So, we spent some time internally and really sought to answer that question and said, well, let's see what happens if we put a women's product in the market. So we're testing it this year with my own employee population and a few of our clients who wanted to jump on and help us see, would women elect a women's oral health benefit if we made it possible. And so what we contributed was adding an extra visit to the dentist because we think that oral health is really important. And then we built connections to other solutions. So hot flashes are real.
Yeah.
And so, we added a connection in that product to I don't want to call it a device that's, to this beautiful piece of jewelry a woman can wear that heats and cools your veins and kind of can help with that. We created a connection to a healthcare partner who has a telehealth offering for women who don't have ready access to an OBGYN. And so we're trying to recognize our role in really creating awareness around oral health and how important it is, but also building some of those connectivity points with other folks, healthcare leaders, innovators in the space who can bring offerings to the table to maybe help some of us shortcut finding a solution for other needs that we have. And so we're testing it this year. I think it's been incredibly well received, even in some areas we weren't expecting. And it's really igniting our innovation engine to think about what other things could we do for different populations, like older Americans or younger Americans, or, and start to think about folks a little bit differently. So this has been a really powerful invitation to innovate as a 70-year-old company around what we do by simply bringing some of our personalized experiences to the table. And um, we're 70% women in our workforce, and that's not
I
unusual
know
in
that.
healthcare. And so we know that 50% of the population is going to go through perimenopause and menopause. Well, I have 70% women and I have pretty high tenure. So, what I love is the opportunity to walk around and engage with the folks that work for us who feel really inspired. I did warn you that I
Yes,
had
I heard
very
them. That's
excited
fine.
dogs
Oh,
here.
good.
So
That just means you love
they
animals.
love
You
hearing
keep
me talk
going.
about this.
They're like, go, mommy, go, go,
I know.
mommy, go. I love it. I love this idea around. I just got super excited. I wanted to jump in, but I let you finish around holistic care because you can't do dental health in isolation. You can't treat hot flashes in isolation. You cannot do any of this in isolation. So the idea around, of course, it's a woman-led company, but sorry guys, I love you men as well. But the idea around holistically taking care of women and not making that a barrier for them,
Yeah.
going to one doctor, going to the next doctor, getting built for this, getting built for that. When it's all connected, it makes us more likely to take care of ourselves. And it shows that a company really cares about us as women. So I love that. I appreciate that. Yeah.
Oh, I love that you highlighted the wonderful men in our lives. I will say more and more men
Yes, they
even
are.
say, "You've given me something to talk about at home," or
Yes.
"I'm so happy to be a part of this." And then, I just want to say, invitations like this where we get to leave women with feeling like prioritizing your health and not feeling like what's happening to you as you go through these hormonal changes is any kind of failing it just embrace it, own it. We all go through it. You're in very good company, and prioritizing um, our health and inviting our healthcare practitioners to help, participate in that journey. I mean, what an incredible path to awareness you have created. And I just so feel so honored to be invited to talk a little bit about my own experience, but also what our organization is benefiting from by just getting to play a small part in this conversation.
Yeah, it's making a huge impact, and I appreciate that. A lot of the women who listen to the podcast, they're leaders in their careers, in their families, in their community. For a woman navigating menopause while leading teams, managing a family, caregiving for their elderly parents, what's one mindset shift that helps her advocate for herself, both in a dental chair and also at work or home?
I would just kind of come back to the biggest mindset shift is appreciating and really embracing what you're going through. I mean, I think more and more and more our ability to own what we're able to juggle and put in perspective and prioritize. And I think, again, never view it as a failing. I mean, you show up and you just don't feel well. I mean, I had terrible migraines when I went through perimenopause that were debilitating, and learning to own that by saying, you know what? I don't feel well today and I'm not going to be able to give you my best self. So we can meet tomorrow or, I'll give you the best I got.
No,
Um,
true,
I
true.
think, and surrounding yourselves with folks who really help share their experiences, and through that we uplift one another, and you appreciate that. Most importantly, you are not alone navigating something unique and awful, and you are with all of us, and we are all navigating these same things. And the more we talk about it, the more we own it, the more we share with one another what works, what hasn't worked, how we think about it, and the more we make it okay to talk about it in our places of work,
Yes,
the better off we all are, because those of us in leadership positions, we are casting that leadership shadow to make it okay for the women coming behind us, for the men coming behind us who have women at home who might need their help one day
yeah,
because
yeah.
they're just not going to be able to do whatever it is they had planned. I think it's a big mindset shift. I am very encouraged that in every conversation we have, it feels like we're building this beautiful momentum
Mhm.
around it being okay, better than okay. It's good. And I know that in our organization, because I happen to have the beautiful seat of running the organization, I love nothing makes me happier than when I engage with our employees and they hug me and they say, I am so glad you're a woman, and I am so glad you have made it okay for me to talk about menopause at work.
Oh, wow.
And it just makes me
There.
emotional. And I think it's
Yeah,
2026,
yeah,
and yet we are still moving things that
yeah.
are in our paths. And so if you're listening and you're in a leadership role, whether you're an individual contributor with influence and you have a team, you play on a team, making it okay for other women sometimes is an incredible first step. And the mindset shift is embrace it. And you're in good company.
Yes, yes, you are. I love it. I love that. I love that so much. I always like to end our conversation. Well, first of all, this has been an amazing conversation. I love when I get re-energized. I'm like, people are actually listening out there and doing work and making it easier for for my daughters-in-law. Yeah, and then
Yes.
I have grandsons, but maybe they're wise. We have to start somewhere, so it feels like the ball is actually rolling, and it also feels like Delta Dental is at the core of getting that ball to roll and to holistically look at this care for women. So I'm excited about that. I like to end the conversation with a reflective question. So if you could give your 25-year-old self one piece of advice, what would it be?
No, I was just having this conversation with somebody last week, and my 25-year-old self really tried to keep my personal life out of my professional life because I was new career, aspiring to do great things. And I think I believed that if any of my leaders or people around me thought I had distractions at home, that I would be less successful. And I would tell my 25-year-old self, no, you should show up to your place of work as your whole self and be more open about sharing uh, elements of your personal life, your experiences, what got you here, what you're hoping to get to. Maybe be more transparent around that. I learned it over time, but I did spend quite a few years really keeping those lives very separate. And I think a lot of us do. And I think I would tell her to not do that because um, your your success really is about your ability to bring your whole self to work, and you're going to feel a lot better if you're not trying to hold up some wall between who you are at home and who you are at work, because at the end of the day you just are who you are. So very long answer, but I was talking with a group of women about it last week who are still in younger career, and it's so important. But that's what I would tell her. And the other thing I would tell her is always do your pre work. Never walk into a meeting without knowing what you want out of the meeting.
I like that. I like that a lot. Yeah, both of those. Yeah, someone told me the second one younger, uh, um, further back in my career, about 10 years ago. But the first one, I had never thought about that. But I think at our age, that's how we were trained because it was
Absolutely.
male dominated, and we couldn't show up as a mom with three kids who needs to get to soccer practice and cook dinner, in between to meet, it,
Yeah.
we weren't allowed to show up that way. So I love
Yeah.
that you thought about that. No one's ever responded that way. That was a good one. That was a good
Yeah. Thank you.
yeah, yeah. So tell us how, and the listeners, how they can get in contact with you or with Delta Dental and or additional information.
Well, specific to this topic, I think my team's done an incredible job of curating and pulling together everything we know at our website, ddins.co/menopause. So go there because the email template's there and everything we could find, including all of our surveys and research, we've pulled into one place. I'm sure you'll put the link out there. I think that's really important. Follow us on social media. We've got a really incredible team that tries to keep that awareness flowing, and anything we learn, anything we do, any insight we glean, and kind of what we're trying to do as an organization to help make sure that we're bringing oral health care to the forefront and inviting people to think about it as their preventative care touch point. We do in that way. And yeah, just if you're sitting out there and you haven't been to the dentist in a long time, maybe get out there and make your appointment and think about how you're going to show up to that appointment. So thanks for asking that.
Yes, yes. Thank you so much. Thank you for spending time with me today.
Oh, thank you so much for having me. It's like I said, channels like yours who really reach the folks that we want to be able to tell our story to. So I feel really honored that you had me on.
I appreciate that so much. Everyone, thank you guys for listening to Hello Hot Flash, where we help you control the midlife change. Again, all of the information that we discuss will be in the show notes, and I'm excited for you guys to come back next week. Everyone, here's to your health. Most women know menopause can cause hot flashes, sleep problems, and mood changes. But here's something that surprises a lot of people: menopause can affect your mouth too. As estrogen levels decline, many women experience dry mouth, tooth sensitivity, and changes in their gums. Some even notice their teeth feeling different or their mouth feeling uncomfortable more often than it used to. The surprising part: most women don't realize those symptoms can be connected to menopause. That's why dental care during this season of life is more important than ever. Regular dental visits can help catch small changes early and keep your teeth and gums healthy as your body goes through normal hormonal shifts. Your smile is part of your overall health, and taking care of it during menopause is one more way to support your well-being. Delta Dental Insurance Company, protecting your smile through every stage of life. Visit deltadentalins.com for more information. The link is in the show notes. Again, that's deltadentalins.com.